Good afternoon, good afternoon, good afternoon, everybody. Good afternoon. Thank God it's Friday.
Friday.
Oh, God, I live for Friday. I can't speak for God. I live for Friday.
Yes.
And two reasons. Because it's the intro to the weekend. And then it's another edition of the CareSouth Carolina Community Live podcast.
Say that again.
It's another edition of the CareSouth Carolina Community Live podcast.
Yeah. Don't y'all go crazy. Contain yourself.
That's right. And if you would notice, we have a packed house today. We have a very, very good panel. We're going to have a good discussion around the COVID-19 and the vaccine and get an update on the data for the PD region. And we also have our friends from the Red Cross we're gonna get into a discussion about the blood donation, which is very, 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 very important right now. And along with my friend Maisha Thomas, who's the site administrator over at Chesterfield. And me myself, I'm in on location in Toronto today. So I just like to stay on the move. Um, yes, sir. So before I talk y'all to death, I'm gonna let my panel introduce themselves, but I'm gonna start with myself. My name is Mark Calhoun. I am the Director of Social and Community Services for Care South Carolina, and I'm always here with my partner in crime.
Yeah, my right. Excuse me. This is Daniel. I'm coming in from the forest, from the jungles of South Korea. Just trying to make it in. Glad to be here today. Just glad to be with everybody. I'm Daniel Myers. I'm the MATHD Program Director for CareSouth, and glad to be on with everybody today. I'm looking forward to this one, Mark. I'm really looking forward to it.
Yeah, me too. With everything going on with the Delta variant, we felt it necessary to kind of get an update of where we at in the PD and get some information from Dr. Smith, and because we hadn't had him up here in a while, and then also the blood drive initiative that's going on at Care South Carolina. So we're gonna jump right into it. If we could start with introductions, we're gonna start with Dr. Smith up in the corner.
I'm Dr. Smith, but I am confused on one point. Daniel said out of the jungles of South Korea.
Yes.
I don't think South Korea has any jungles anymore.
That's why it's so strange.
Okay. Oh my God. Okay. And then our guest from the Red Cross, please introduce yourself.
Mandy?
Hello, I'm Mandy McWhorter. I'm the Regional Communications Manager for the Red Cross of South Carolina. We're glad to be here with you today and excited to talk about the upcoming blood drive, as well as a lot of blood-related initiatives the Red Cross has coming up in the next few months. Thanks for having us.
All right, anytime. Thank you.
Yes.
Aisha?
Hi, I'm Maisha Thomas. I'm the site administrator for the Chesterfield location at Care South Carolina. Happy to be here.
All right. Douglas.
And I'm John Douglas. I'm Chief of Business Development for Care South Carolina, and I am a proud numbers geek.
That's right. That's right. We definitely wanted to get him on here so we can kind of talk about some of the numbers that we're seeing here in the PD area. We're definitely seeing the numbers go up, not only nationwide, but here in South Carolina, especially here in the PD area. We're seeing the COVID numbers go up. Some of the numbers here at Care South Carolina over a 2-week span, we've virtually tripled that number from the last time, or doubled that number from 1 week to the next week. So and we kind of see that trend going on throughout the state as well. So we wanted to get John Douglas. He's our number crunchers. He has put together a what he calls it this daily digest that he kind of updates daily, and it provides a lot of information about the numbers here in the PD area as it relates to the COVID-19 virus and Delta, and as well as vaccine rates as well, right, John?
Right. Can you pull up any of the graphs?
Absolutely, sir. Just a second. There you go. We're good?
I'm not seeing it yet. There we go. Yeah, this looks at the reported cases of COVID in our 5 service area counties by month, going back to March of 2020. And you can see the big spike that we had in late December, January, and February. And then in March, things got drastically better and continued on a downward path until July. And then especially now in the first few days of August, that trend line is heading back up. We still are nowhere near where we were, say, in January, but the cases are definitely on the rise.
Okay.
All right, this is looking at the 7-day average of new cases in the service area as a whole, as well as each of the 5 counties individually. 2 weeks ago, we were averaging about 20 new cases a day in those 5 counties. In the span of 2 weeks, we've gone from 20 a day to 60 a day. So 3 times as many cases each day. DHEC yesterday reported 102 cases in the 5 counties.
Wow. Wow. That's a lot. Let's move to the next one.
Okay, here we look. I keep track of this daily for us. It's the rate of vaccination in each of the 5 counties, and within each of the 5 counties, each zip code. And Marek, you may want to chime in with how this information is used to target our efforts. But one thing to note is there's quite a variability in the vaccination rates within our service area. On a county level, just over half of those 12 and older have had at least 1 dose of the vaccine in Darlington County. But on the other end of the spectrum, Marlboro County, only 35% have. So you've got 50% in Darlington and 35% in Marlboro. Then when you look beyond the county level into the zip codes, Little Rock in Dillon County, but on the other end, Lynchburg in Lee County has only 25%. So within our 5 counties, you've got one community with 25% vaccination rate and another with 70. So there's quite a bit of variability from community to community in the service area. And one thing too on this that I look at, we really have more of a gender disparity than we do a racial disparity in the vaccination rates in our 5 counties. And in that, I mean that females are much more likely to have been vaccinated than males.
Wow.
Yeah, that's strange.
Yeah. And just kind of what John alluded to, how we kind of use this data. So one of the things we're doing now to use this data, we're in the process of mounting a outreach campaign out in the community, and even going door to door, passing out information on how and where the vaccine can be administered, how you can get the vaccine, where you can go. We out there to answer any questions that you may have related to the vaccine. So we've been looking at the zip codes and the information that John provides, and it provides a target area of where it gives us a blueprint of where we want to hit the target areas we want to provide the outreach to. So those lowest vaccination rate areas, those are those areas that we definitely want to target. We want to get out into the community and have those discussions, pass out the information, make sure it's readily available to everyone, and make sure that they know how to get on the vaccine if they need assistance, such as transportation to get the vaccine. And we're having those conversations as well.
Right, and Marek, I'll point out that through marketing, through social media and other avenues, a few weeks ago, concentrated on McCall and Dillon because those were 2 of our low vaccination rate zip codes. And it was good to see progress in those communities. Both are still low, but they have climbed above 30%. So not only are we doing this, but we are also seeing results.
Right, right. And like you said, that target to getting all of our communities, 30 at least to 30% was kind of the first goal that we had. And those, like you alluded to, those areas we were able to get above 30%, which is I think it's a great thing and a monumental task. So now we got some areas like Lynchburg, they're around 25% that we're definitely want to target and work on. So we're out in the community. We started our door knocker campaign. So if you see us out there, you have any questions around COVID and the vaccine, please let us know. We'll do our best to kind of explain and give you as much information as we can. And if there's something that we don't know offhand, I'm sure we'll definitely be able to get that information to you.
And one other thing on vaccines, there are a lot of entities, great entities providing the vaccine throughout our service area, but CareSouth Carolina has administered about 1 out of every 4 vaccine doses in the 5 counties.
Absolutely. All right. Did you want to go through this one, John, or are you good?
Yeah, I'll just briefly show. This is a look at South Carolina, July 20th. And then if you scroll, Marek, if you'll scroll down, and the darker red is getting worse, is not good. You see by August 3rd how the state looks. And this is from the Mayo Clinic. And then they do a forecast 2 weeks out. And if the bottom version of the state there, you will see on August 17th how the situation looks. Now, one good thing is our part of the state isn't the worst, but the whole state's looking pretty deep red at that point, especially the Columbia area and down along the coast.
Wow. That's scary.
That is scary.
Yes.
That's scary.
It really is scary. But looking at those numbers rise, I'm glad I'm vaccinated. I'm glad I got the vaccine. And we're here to encourage everyone. Get the vaccine. As we go to Dr. Smith here, just thinking about the vaccine, Doc, how can we convince others to get the vaccine? How can we do that?
Well, that's a good question. So let's just say you have a loved one and you would like for them to get the vaccine. How would you address it effectively with them? And I think the first thing that you have to do is drop any sense of moral outrage or anything like that. Looking down on other people just makes people more defensive, makes people more draw the lines and puts up barriers to even paying attention to what you want to say. So this is true whether you're trying to convince someone to get a mammogram or anything else that would be good for their health. The second thing is listen to their questions and treat them legitimately. For instance, according to some poll that was out 10 days ago, it said that if you were to ask people who were not vaccinated, why do they not want to get vaccinated? Right now, this wouldn't have been true a couple months ago, but right now, the number one response is that they are not convinced it works against the Delta virus. In fact, that was 65%. Now, of course, these are people who are already viral vaccine hesitant to begin with, because they're the ones who haven't gotten it already. But that's a chunk. So you take that as legitimate. What is their concern, and can you answer that question? So let's just say somebody would say something like this. Well, if I am vaccinated and if the vaccine works, how come I still have to wear a mask? No, if the vaccine works, I shouldn't have to wear a mask. Why is this? And when you answer a question like that, you have to be very careful. John Douglas isn't going to appreciate this, but the answer is math, and a lot of people don't want to hear math. Okay, if you mention the word math, they have bad memories from high school, and their eyes will glaze over, and you lost them. So, I frequently, with this or with other things, will try to bring them in with an analogy. And I'm just going to use an example. I hope you don't think I'm taking too long to answer this question, but I think it's an important question. Let's just say you have a daughter who's 21 years old, and you hear that she got into the car with a drunk friend of hers and rode back to campus with a drunk friend. And you go to talk with her about this, that you think that that was not a good decision. And she responds like this: well, Dad, I'm trying to get the eye roll. Well, Dad, you say that driving drunk is unsafe, but Uncle Joe, he drives drunk frequently and he's never been in an accident. And Aunt Martha was in an accident last week and she never drinks. Therefore, doesn't that show that not drinking, or that drinking doesn't make you more likely to wreck? I mean, look at Joe and look at our aunt. Now you hear that argument, do you say, oh, Susie Q, I never thought about it that way. I guess you can go ahead and drive drunk. And let's say it's true. I mean, not everyone who drives drunk is going to have a wreck. And not driving drunk does not guarantee you're not going to have a wreck.
That's right.
However, driving with somebody who is drunk increases the likelihood that you are going to have a wreck significantly. Mm-hmm. And you can do that because nothing's 100% in medicine. You can do this with virtually anything. But I'm going to try to narrow the conversation in here. And so, okay, I heard from people who were vaccinated, family members, not CareSouth employees, but who were vaccinated, who were not anti getting the vaccination, but they heard that Senator Graham has tested positive and and he's fully vaccinated. And their response is, "So I guess these vaccines don't work." Okay, so how do you answer this, intelligently? And what you would say is, well, the likelihood that Senator Graham is going to end up, even though he is elderly, dead, having had the vaccine, is dramatically less likely because he has had the vaccine.
Right.
Nothing's 100% in medicine.
Yes,
there are going to be breakthroughs, and so that's how you address it. Similarly, chance that you're going to end up in the hospital if you've had the vaccine is dramatically less than if you did not have the vaccine. The likelihood of you getting it at all is less also, but it does happen, particularly with the Delta virus, but you're much less likely to end up in the hospital or to end up dead. Now, of course, in my situation, as I imagine these young ladies don't know, back in November, I got sick with the virus. As you might guess, I did not die. But I did end up on event watch. I was in the hospital for 6 days. I was oxygen dependent for about 2 weeks after that, out of work for about a month. And when I got out of the hospital, I looked horrible. And I can, look someone in the eye and say, I wouldn't want that to happen to you. Right. Wouldn't want you to go through. No, I did not die. But I don't want you to go through what I went through. And I don't consider myself that old and fairly fit and no underlying conditions at all. And so that's That's how I would address it. Now, literally moments before I got on the air, I saw an email that brought up some interesting points. So let me address some of that. The question was, well, Steve, you are sick, you have some immunity. Why did you go ahead and get vaccinated when people who have had the virus, confirmed have the virus, confirmed had antibodies, are less likely to die? In fact, I think the way it was phrased in that bullet point, if you have had the virus before, and if you get COVID, you're not going to die. And for practical purposes, that's true. It's going to give you enough protection. You are not going to die. Most people don't die with it, period. However, as in that same bullet point, it says, but you could get sick and spread the virus. So if your bar is, as long as I don't die, I'm okay, well, that's fine. That's a pretty low bar. And because, like I said, I don't want to get sick again. And as we speak, there are CareSouth employees who have had the virus before and are now out sick, missing work and feeling bad with the virus again, unfortunately. So clearly it didn't protect them enough. And one thing that everybody is clear on is that if you do get the vaccine, on top of having the virus, it offers significantly more immunity. Also, for CareSouth employees, we're around some uniquely vulnerable people. It's our job, and so we probably need to be extra careful. Also, something came up on the myocarditis, but that's really too much to go into on this. But there was something put out, I think, about epidemiology department at MUSC showing a stadium and the likelihood of this happening to you if you're in the stadium versus this. Probably we'll post that from the epidemiologist who know more about it than I do. I hope I didn't draw on for too long. I hope that wasn't too boring. We'll go on to the other people who I'm sure will be more interesting to me.
Okay, but before we move on, I do want to ask a question about the Delta virus. What makes this strand of COVID different from the previous strand?
Another couple things. One is it has more of those unfortunate spikes that make it more contagious. It spreads faster. And because it spreads faster, the relative kids who were relatively less likely to get it are now are getting it than before. So as we speak, there are 4 kids in the McLeod pediatric ICU. I didn't say hospital, I said ICU with it. May not be a huge number, but if you're those families and your kid is in ICU from COVID, I imagine that's a pretty scary thing. So it spreads faster, and also it presents a little different, which is unfortunate because that makes it easier to miss. With the other virus, if you had a bad runny nose, you probably did not have it. That would always be evidence against you having it. Here, having a runny nose, sore throat is one of the top 5 symptoms. And with the other virus, if you had a lack of smell, okay, and it's a weird lack of smell. It's not just because your sinuses are congested. I mean, your nose doesn't work. That was one of the top 5 symptoms. With the Delta, that drops down to like number 9. And so, unfortunately, it makes it a little bit hard to take a history and feel confident that you're correct. Did that answer your question?
Yes, sir. Yes, sir. So why is it important for us to we've here and increased the mask wearing? Why is it important for us to continue to wear our mask and in addition to, again, getting vaccinated? Why is it important for us to continue to wear our mask?
Well, because if you do get sick, and you can get sick even if you're vaccinated, unfortunately, um, you can still spread the virus. And like I said, I realize a lot of people here are not necessarily CareSouth employees, but we're trying to make a safe work environment for the other employees and a safe work environment for our patients. And so trying to keep those droplets inside your mask. Remember, those masks are more effective at protecting other people than they are at protecting you. Okay. Um, it stops you from spreading out your droplets to all your coworkers. This is not a case for sharing is caring.
Wow. Wow. Absolutely. I appreciate that, Doc. Thank you for that information.
Okay.
Yeah, absolutely. So as we move forward, we understand the severity of the COVID-19 virus. Um, I can say I've seen something I've never seen um, in my life. The other day, I was in the Hartsfield site, and that's where they're doing the monoclonal antibody treatment. I did not realize how many people, until you see it, actually is getting that treatment. Um,
And
it
did you
was
notice how sick several of them were?
yes, it was unreal to see what I saw, and there were some kids in there as well. Um, let me before we go to our next guest, Dr. Smith. Let me ask you this: early on, the original strand of the virus, we saw where it didn't really affect kids at the level that we're seeing now. Um, could you kind of tell? You may have answered this, and I may have missed it, but kind of why is that? Why are we seeing such high rates of infections and sickness in kids now than we did previous?
Okay. Fortunately, 80% of the folks over 60 in America are already vaccinated. If that were not the case, you would be seeing the folks in the nursing home dying and all too, just like you did the first time.
Okay.
So because the older folks, again, like I said, you can still get it, but less likely to die from it and whatnot, that spreads it to the most vulnerable of those who are unvaccinated.
Mm.
And the most likely to be unvaccinated in this version that is more contagious are the younger people. You start going down in age, you have more people who aren't vaccinated. Down when you get to kids that are under 12, you don't have a vaccine for them. And so if you are unvaccinated, you're more likely to get it. The younger you are, the more likely you are to be unvaccinated.
Do you know where we're at for those kids that are under 12
No,
as far as vaccinated?
no, I do not.
Yeah. Okay. Well, we sure appreciate that information. I know at this time there's a lot of needs going around. For different families, different individuals, and one of those needs are the need for blood. We have a guest here today from the Red Cross. Mandy, how you doing today?
Doing well. Thanks for having the Red Cross on today to talk about the need for blood.
Absolutely, absolutely. This is definitely the need for blood donations is very, very high right now. Could you go into what's needed?
Yeah, certainly. Right now, we're in what we are calling a severe blood shortage, and that's due to a number of different factors, but it's an unusually high number of emergency and trauma visits to our hospitals. And we've been in this blood appeal for several weeks now, unfortunately. And the good news is we're seeing donors start to come out, but the hospital orders are still outpacing the rate that we're able to bring in blood. So we're asking anyone who is eligible to please come out and give blood. And I know we're excited to have a blood drive here with CareSouth a week from Monday. So thanks for hosting and being a blood drive sponsor. It means a lot.
Absolutely, absolutely. I know early on in the first wave, they talked about blood donations in terms of those who may have tested positive and have antibodies within to encourage them to give blood. Is that still the case right now?
Yeah, we're past the point now of where we're asking folks to come out and give convalescent plasma because we've been able to fulfill all of those requests from hospitals. And as we all learn more about the virus and the different treatments available, that's an option that still exists. But right now, we're asking anyone to come out and give blood. And the good news is you're eligible whether you've had the vaccine or not. And if you've had the COVID-19 vaccine, the only thing we ask is that you come armed with the knowledge of what vaccine you received. And then at that point, there'll be no deferral period if you've had any of those three main vaccines, so Moderna, Pfizer, or Johnson & Johnson. So that's the good news, is that whether you've had the vaccine or not, there's no deferral period.
Okay. So what should I expect? If I come to Chesterfield and I want to give blood, what does that look like? What should I expect in that visit?
Yeah, certainly. So the visit itself, if you're doing just a regular whole blood donation, takes about an hour from start to finish. Giving blood itself is a pretty quick process, anywhere from 7 to 15 minutes to pump out the blood. So you'll get a small mini physical when you arrive. So we're going to check your temperature, get your vitals. So you'll get a nice little workup when you arrive. We'll check your hemoglobin levels, your blood pressure, all those sorts of things. And then we'll get you on a bed to begin pumping. Then after you're done, we'll ask you to sit in our canteen and have some snacks to get your blood sugar back up, and then we'll send you on your way. So it's a nice, really quick process. And the good news is, besides the snacks and little workup, you know that you're saving lives. So every 2 seconds, someone in the United States needs blood for a number of different reasons. But it's a great feeling to be able to get back and help our communities, because, as we're talking about COVID and public health, one of the big components of public health is making sure that we have a healthy blood supply. And so you can help support that and make sure that your community is taking care of each other, and giving blood is a great way to do that.
Wonderful. Absolutely. That is definitely a wonderful feeling to be able to donate blood, and I'm definitely there for the snacks. So oh, I'm sorry, my provider's on. I can't be talking like that. Bad snack. What other initiatives should we expect, or that you have going on in terms of blood drive?
Yeah, certainly. This year, the American Red Cross has a really big push to educate about the need for diverse blood donors. So when we think about blood, we often think about the different blood types. So A, B, AB, O, and the positive or negative that are associated with all those blood types. But there's more to it than that, and particularly when it comes to sickle cell disease. It becomes vitally important that we're able to match blood donors with the patients who need the blood, even more closely than the types that we're all familiar with. So the unfortunate fact is about 100,000 Americans have sickle cell disease, and most of them are from African descent. So it's important for us to get the message out to African American or Black donors or potential donors about the need for diversifying the blood supply. Because when we think of sickle cell disease, it takes often a more close blood match, and that typically comes from someone with the same ethnic background to match the blood to the patient when they need it. And also, the most frequent type of blood that hospitals reach for is O type blood, and African American donors are more often O type than white donors. So we need to get the message out to African American and Black donors about the need for diversifying the blood supply. And so a couple of different things that we're offering beginning in April this year is sickle cell trait screening. So again, as we're talking about the coronavirus pandemic, health insights have never been more important. And so starting in April, the Red Cross began doing sickle cell trait screening for anyone that self-identified as African American while they're doing that screening at the beginning of a blood donation. So it's one more health insight that we're able to offer donors so that they can be better informed of their own health status.
Wow. Thank you. So Maisha, I think isn't this your second blood drive there in Chesterfield? Correct me if I'm wrong.
No, this is still our first.
This is still your first. Okay.
This is still our first. We didn't get enough donors to sign up the last time, so we're coming back around. And so far, we have about 10 people have signed up. So I'm confident with this podcast and my constant emails that I'm sure you have been receiving weekly that we will meet the need of 24 people. This go round, this will actually be my first time to sign up and donate blood. I've never donated blood before, but knowing that this can save a life and that this would probably be the easiest way I could save a life. I don't see myself running in a burning building. I don't see myself trying trying to save someone diving in the pool. I'm not a good swimmer, so if I can just stick out my arm and donate some blood and that can save a life, I feel like I've done my good deed.
Okay. So what? So was that the main driver for you to have that blood drive? Why was it so important?
Well, no. First, I have to give a huge shout out to our Chesterfield native nurse practitioner here, Sarah Knight. She's the one who brought the idea to me, and so then I presented to our chief of quality, Randy Carlisle, who gave me the okay. And so that's how we've been able to bring the Red Cross here to Chesterfield.
Absolutely. Great deal. Great deal. Well, I will. You count me in. I will do my best to be up there to give some blood. I haven't done that in a long time as well. So um, I do have a question for Mandy in terms of that. I don't like getting blood out of my arm. So can I get it out of my hand if I request it?
In that workup that we talked about initially before you give blood, we'll do a small finger prick. And that's often what people say is the worst part. So it's not so much the pumping blood out of your arm, it's the short finger prick. So no, you can't give out of your hand, but it's a very quick, not so painful process. We think you'll feel good afterwards. And if you need any more incentive to give besides the snacks and saving a life, of course, throughout the month of August, we have a wonderful partnership with Apple Music, and they're offering any new subscriber 4 months for free of that service. So lots of reasons to come out, and we certainly hope that you'll sign up to give.
Okay. I might need counseling after that. But I'm there for it then, I guess. Well, we definitely appreciate you all coming on and talking with us about not only COVID, but the need to give blood and the shortage that we have. It's very important that we're able to give the gift of life, right? And be of assistance and be of service there. Could you tell us how we can get in touch with you and how can we sign up for if we wanted to give blood?
Certainly. Yes, you can sign up at redcrossblood.org and use sponsor code CARE South Carolina, and that'll point you to all the different appointments that are available. And also, I wanted to mention that we'll be offering double red donations at this drive as well. So you can sign up and get two donations in one. And so when you give a double red donation, you're going to get the plasma and the platelets back. So you'll just be giving the red blood cells. So it's a little bit longer of a process, but it'll save you a second trip, I suppose, when you would have been able to donate for a second time. So good way to save some time and get two donations done at once.
Wow. Thank you. Appreciate that. Thank you. Make sure you want to give any last words before we close out.
Oh, nope, just please sign up on the website. Um, we look forward to seeing you on that Monday, especially you, Marek. Come on out, Daniel.
I'm going to come. I'm going to send old McDonald too. Because I think that y'all left his blood type out. He has EIEIO.
Okay. Well, we definitely thank you, and I wish I could place my order for snacks early on, so
Yeah.
when I get there, I place an order. Call ahead snacking, right? Um, so thank you everyone for joining us today. Thank you to our guests for providing the information that was so important. Everything from COVID, and again the vaccine and the need for blood donations. Um, Listen, if you wanted to get in contact with us here at Care South Carolina, You know where to reach us. You can reach us at our website at www.caresouth-carolina.com, www.caresouth-carolina.com, or you can hit us on 866-498-0399 if you have any questions. We appreciate it. And if y'all could stick around when we end the broadcast, so we appreciate it. So thank you, everyone. Have a wonderful Friday. And we will definitely see y'all again next week. And let me not forget, next week for health centers throughout the nation is Community Health Center Week.
Yep.
Look at our website, look at our Facebook page. There's a list of activities that we'll be doing in the community as well as in our centers to show appreciation to the staff and some of our patients. So come celebrate with us all next week, Community Health Center Week.